Why is calcium carbonate administered along with the food? Let's see the answer. Highly water soluble drugs are having an advantage of high absorption. That is, if the drug is more water soluble, absorption will be more. Now let's come to the calcium carbonate. Water solubility of calcium carbonate is very poor. Practically, calcium carbonate is insoluble in water. This limits the absorption of calcium carbonate into blood circulation. A drug can be absorbed only if it shows sufficient water solubility. As water solubility of calcium carbonate is less, absorption is less. Then one question arises in your mind. How poorly water soluble calcium carbonate is absorbed? The answer is given by a chemical reaction. That is, reaction of calcium carbonate with hydrochloric acid. Stomach contains hydrochloric acid, that is HCl. This is secreted from gastric parietal cells. This hydrochloric acid reacts with calcium carbonate to form a chloride. Here is the reaction. Reaction of calcium carbonate with the hydrochloric acid. Calcium carbonate, that is CaCO3, reacts with the hydrochloric acid to form calcium chloride, that is CaCl2. In short, calcium carbonate in presence of hydrochloric acid forms calcium chloride. Now the question is whether this reaction helps to increase absorption. The answer is yes, because calcium chloride, that is CaCl2, has high water solubility. Calcium carbonate, that is CaCO3, is insoluble in water, and calcium chloride, that is CaCl2, is highly soluble in water. From these points, you can understand that hydrochloric acid helps to increase the absorption of calcium carbonate. This increase in the absorption of calcium carbonate is due to the formation of calcium chloride in the presence of hydrochloric acid, which is secreted from gastric parietal cell. Hydrochloric acid present in the stomach converts calcium carbonate to calcium chloride, which is highly water soluble, hence is absorbed highly. Now we have reached at a conclusion that HCl increases absorption of calcium carbonate. Now the question is, when is secretion of HCl high in stomach? The answer is just after eating. Hydrochloric acid secretion is high in stomach. So, when is absorption of calcium carbonate is high? The answer is when taken along with the food. Because when taken along with the food, due to the high HCl concentration inside stomach, calcium carbonate will be converted to calcium chloride, and calcium chloride will be dissolved in the stomach fluid, and this leads to increased absorption of calcium from the intestine. These are the references from where points are picked. Thank you for listening.